Good afternoon. My name is Kevin. I'm the Director of Nursing at Valley West Post Acute, and this is my licensed nurse in service for the month of July. Sending you this link via text message, email. I'm also going to put it up in the posters or post it throughout the building. A couple things I want to go over real quick is I had Dr. Garrison helped us out by doing a YouTube video, and it's actually a YouTube video. So some of you have been watching Dr. Garrison. They subscribe to Dr. Jared Garrison, and you can actually watch this YouTube video on that now. He updated it so that it's on his website. Previously, that was not the case. Anyways, bear with me. I'm new to this sort of thing. Anyways, so watch Dr. Garrison's in-service on YouTube. Watch my in-service on YouTube, and we'll go from there. And I'll do my best here to do this without any technical difficulties. Okay, let's go. So we're going to talk about how we're working things right now. Right now, we've got COVID-19 in our building, and it's really bad. We've actually got 18 beds in our red zone right now. Our red zone is 101A to 111B. Every room is full. Now, just so you know, the nurse that's assigned to that area cannot provide care for anybody else anywhere in the hospital. They can't go from the red zone and provide care into the yellow zone or anywhere else. We have a separate entry. We have a separate log where they're taking their temperature. They have a separate break room and a separate bathroom. So those people are separate from the rest of the staff, and for a good reason. You know, we've got COVID-19, we've got coronavirus right here in our building, and those people are assigned to just that area and that area only. That includes no housekeeping in there, no maintenance in there, and therapy. Therapy can go in there, but only certain circumstances. So, like if we have a physical therapy that's going to go into room 109 to take care of that resident, they can do it because they were previously positive for COVID-19, have since recovered from their illness, and have been past many days so that they are not symptomatic. So at the end of the day, they can go in there, their last patient that they see, just before they're leaving the building. And then they can go in there and treat those residents. They will, of course, wear N95 mask, full face shield, gowns, and gloves while in that resident's room. And they're going to scrub their hands really good when they come out. So anyways, we also have a yellow zone. Yellow zone is the rest of Station 1. And that starts at room 112. Run 12 to 115. Yellow zone, I can't mix those staff either, and the reason is because that staff is caring for residents that may or may not have COVID-19. So let's think about that real quick. I can't have the same nurse that's working in somebody who's positive for COVID-19 and somebody who's working with somebody who might have COVID-19, because then we will have given that to them. So unfortunately, I have to have separate staffing. Red zone staffing, yellow zone staffing, Station 2 staffing, and Station 3 staffing. Makes it very hard. But anyways, people that are put in the yellow zone are people who are having a change of condition. They're having some sort of respiratory illness, or they're having some sort of a change of condition. We put them in the yellow zone, we test them, and until we get results back, that's what they're there for. So careful with that area there. Next, daily tracking. You know what? We've developed a spreadsheet, and the spreadsheet is updated daily. This spreadsheet is kept in a binder over there on Station 1, and it's meant to be for Dr. Garrison or Maksud to review and to see what's going on with those residents. Now, it will have information like today's temperature, their respiratory status, like are they coughing, any shortness of breath, what is their O2 sat, and are they on oxygen when they hadn't been in the past? Actually, what are their breath sounds? That means you have to put a stethoscope on their chest. Also, any symptom that's out of the ordinary. This symptom might be like, they're behaving badly. They're now hitting more when they've never been hitting before, or they're screaming out, and many times people with severe dementia can't raise their hand and say, oh, by the way, I'm feeling body aches, chills, and fever. They can't say that. What the symptom that we might see is they're eating less, they're eating less, behaving badly, maybe having diarrhea, vomiting. We had one resident who was drooling quite a bit more. Anything that's out of the ordinary. We're moving them to the yellow zone and testing them, and we're going to list them on our daily tracking. That way, Maksud can page back and say, oh, well, it looks like they had this symptom yesterday, but now today they're having this symptom. They'll be able to track it really good. Anyways, so part of my rounds every day is going to be to get that information and put it on those spreadsheets. And again, that is private information. You will see on there the dates that everybody was positive and dates that people are negative. These are our residents. That's confidential information. Please do not disseminate this to other staff. Don't make copies. It stays in that binder. Thank you for your attention with that. Okay, reducing the risk. You know what? We've actually done some root cause analysis. We found that there were a couple things that we're not doing very well with COVID-19. We actually changed a few things. We changed break room. We're encouraging people. Now, I can't say that you're not allowed to go to a break room. The labor law attorneys would love to have a lawsuit against me. But we've taken the table and chairs out of the break room because, well, that's an area where people take off their mask and then they are conversating with each other for like 30 minutes with no mask on. We think that that may have been one way that the coronavirus may have spread in our building. So no crowding at the nurse's station. Use an overbed table when you want to do your charting. So what that means is that we can have one nurse or one CNA at the nurse's station sitting at a table there. But because those chairs and tables are kind of closer than 6 feet apart, we want you to consider getting an overbed table and charting out in the hallway when you're 6 feet apart from somebody else. Absolutely no food or drink in the nurse's station. This means you. I don't want to even see people who have a Monster or a Rockstar that's underneath the sink in a cabinet there. Well, gosh, Kevin, it's got a lid on it. No, we are not allowed to eat or drink in any patient care areas. That includes hallways, nurses' stations. The only place you can have food or drink are in your car, outside on the patio, or if you're lucky enough to be assigned an office, you can have food or drink in your office. So please, 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 COVID-19 is spread by mouth, eyes. So if I've got my drink out at the nurse's station and I've got residents that are walking by coughing and sneezing, guess what? When I go to drink that, I'm going to get coronavirus. So please, no food or drink. Use your car that's in the break room. I know that on night shift that may be a hassle because there's nobody to let you back in that door. I really don't want you on night shift to be propping that door open with that little thing, that little kickstand. Not allowed. So please use your car as a break room or outside, or if you are lucky enough to have been assigned an office as part of your job, then you can eat in your office. Wear your mask and goggles correctly, please. Now, we've seen people who have one thing hanging off like that, or crisscross on the sides, or hanging off their nose because they can't breathe. No, we need to wear it correctly, 100%. And we are actually asking people to do a seal check. And how do you do a seal check? Well, I can tell you right now that mine's not sealed very good because every time I exhale, my glasses are fogging up. So that means to me that I've got a leak right over here. But if you breathe in really closely and then blow out, do you feel your eyelashes fluttering with the wind? You didn't have a very good seal on there. Make adjustments, pinch it up around your nose, make the rubber bands tighter, put them up higher, something. But we have to have a good seal, and unfortunately you're gonna have to wear that all the time when you're inside of our building. The only time you can take it off is when you go to the restroom or out to your car, or if you're lucky enough to have been assigned an office as part of your job, you can take it off in there briefly. But if somebody comes in your office, then you have to put it back on. So another thing, I've updated the check-in, the sign-in log up at the front desk there when you come in every day. It's actually got a lot more symptoms on there. It's got, you have any recent loss of taste or smell, or you have a sore throat, body aches, headaches, fever, chills, any of those GI symptoms, any of those things. So now they're instructed at the front desk that if you answer yes to any of those questions, you are not allowed in the building. Stop. Do not pass go. Do not come into work and clock in. Wait right there for a nurse to come in and screen you. They will talk to you, and now we just don't want coronavirus to spread in our building. So don't use this as an excuse to get a day off. Come into the building. If you've got a sore throat but you have allergies this time of year every year, let us know, and then we'll keep an eye on your symptoms, and we'll actually monitor you. We'll be talking to you throughout your shift to see if those symptoms are going away. But you may be sent home. We have a spreadsheet that we're tracking employees too. Employees that are positive and their symptoms and stuff are all listed here. Daily we are updating this sheet. Here's another thing. No nebulizer or aerosolized medications should be given here in our hospital. So how is coronavirus spread? Well, it's spread while it's being attached to the little water droplets from our breath. So the little water droplets in our breath may have coronavirus on there. So if I've got a resident that's breathing through an aerosol mask or the T-piece, they're getting virons or virus from their lungs attached to a little droplet of water, and they're blowing it out in the air around them. So that's one way that coronavirus can be spread. So we actually have 3 residents that have aerosolized treatments right now. So please, we're discouraging the doctors from prescribing that. If you've got a resident who has aerosol treatments on there, call Maksud. He'll give you an alternate. The HFA nebulizers are difficult for some of our dementia residents to operate. You have to coordinate it with a breath in at the time you're squeezing it. There are these spacer things that we can get from the pharmacy. They'll be happy to send them. So you spray the inhaler into the spacer, and then when you're watching them, they breathe in and you push it in really easily. Next, I guess that was it. Well, I do have a couple more things on my list to talk about. No food or drink in the nurses' station. There are signs up. N95 masks. Let's talk about them a little bit. You notice that I'm wearing one of the ones that we ran out of. I got one of the last ones. This one's kind of comfortable. I could wear it for 12 hours and not suffer a pressure injury on the bridge of my nose or something like that. I get a good seal. Anyways, haha, I got one, you didn't. But we have bags over here that we're doing 3 bags, 1, 2, and 3. we actually have enough masks to go 5 days, maybe even daily. So what we're asking here now is over in the red zone isolation area, those nurses will wear one N95 mask all day and throw it in the garbage. Get a new one when they come back to work. We have enough N95 masks. I have a lot of small. Anybody want a size small? I've got several cases of them here. Nobody seems to like the small ones. But anyway, so that's what we're doing on N95 masks. Now, there is a push to get everybody fit tested for N95 masks. So Janice is coming up with a schedule. She's going to try to do as many as she can every day until the remaining staff that need to be fit tested are finished. Right now, less than half of our staff have actually been fit tested. So we're working on that. Another thing that we can do in our resident rooms is privacy curtains. You know what stops the spread of coronavirus is to have that privacy curtain pulled just up to the waist of the resident. So you don't have to pull it all the way around the resident and close them into their privacy curtain. Just pull it about halfway past their bed so that they're not able to see the resident next to them. That actually is a physical barrier, and it's good for making sure that there's no spread of disease between them. Remember, coronavirus is somebody could have that disease, be asymptomatic, in other words, no symptoms at all, but be a spreader of that disease. So even our residents that are doing just fine, not having any symptoms, no cough, no fever, no DSAT, they may be laying in their room, but they may have COVID-19 and could spread it to their roommate. So that's why we want to have the privacy curtains pulled a little bit. Let's see, the fire door on Station 2. So all the fire doors are kind of kept closed. Station 3 probably not, but anyways, that just limits the flow of air circulating through our building. We're just going to kind of keep those closed. What a hassle it is to push a cart and you have to stop and open a door, but we're just going to have to deal with that because that helps reduce the spread of coronavirus. Clean the thermometer after each use. Room assignments. It's actually just going to get kind of tight. You know, we have several staff right now that are out sick. They're either having symptoms or have tested positive for coronavirus. So one of the rules is that for essential healthcare workers is that when you've been tested, say for instance you tested positive on the 1st of the month, 10 days later on the 10th of the month, if you are symptom-free or at least on the mend and getting just almost better, you're just a little fatigued still, on your 10th day, then you can return to work, provided you have no fever or no symptoms. Now, you can return to work earlier. Here's a circumstance for that. Supposing you test positive for coronavirus on the 1st of the month, and on the 6th of the month, you don't feel sick. I mean, so 6 days later, you could actually work in the red zone and take care of our isolation residents, whether you're a CNA or a licensed nurse. So that's the thing there. 6 days if you want to work in the red zone, 10 days if you want to work anywhere else. We just have to follow that. But staffing is going to get kind of tight here because we're not able to get a lot of help from NPH. Believe it or not, people don't want to come to our building. Not sure why, but NPH is sending us as many as they can. We contact them daily. Please believe me, we contact them sometimes as many as several times every day to see what they can send us. But I'm likely to have 4 nursing areas. A red zone has to have their own special nurse. Yellow zone has to have their own special nurse, can't cross over anywhere else. And then Station 2 and Station 3. That's really tough to come up with 4 nurses every shift, night shift and day shift. Now, there are sometimes Hopefully they'll be few and far between. I know this weekend coming up, we may struggle with staffing over the weekend, but I need people to please be helpful. There's a lot of you who really only want to work day shift and weekdays, but I struggle on weekends, and I need to be here personally. I need to be here weekdays because there's reporting I have to do to the Department of Public Health, and there's staffing reports I have to send to Sunmar. Just a whole bunch of stuff that I have to do during the day to manage staff, and then to have to come in and work nights on weekends too is really killing me. So I just need help from as many people as possible. I'm willing to work on a cart. You know, that's what I've done for years. I've been a nurse for a long time. I can work on a cart. I'm not afraid to. But I really don't want to, because that would mean that I'm working 7 days a week, sometimes 10 to 12 hours, 7 days a week. I'm getting kind of burnt out. So please, if you could pick up an extra shift, and if you have picked up an extra shift, thank you so much for doing that. The other thing I wanted to talk about is just behavior and attitude. You know what? We are all struggling here. Every department has been decimated with coronavirus. So we have our housekeeping department. You know, there's only 4 people left in the housekeeping department right now. That's including their manager. So we have to have somebody doing laundry, and we have to have somebody mopping. Well, 7 days a week, 4 people. It's really hard. So they're working overtime. Many of them are working long hours and on their days off. So if you can help by picking up trash, please don't dump your cup of coffee in the garbage can. It really is kind of messy for them to clean up. And so please help out the housekeeping department. Another thing is we had, our activities department is struggling. They actually have had some people off there in activities too. As well as we actually got a couple of people back in therapy, but we don't have medical records right now. We just got our social service person, Pam, back. Today's her birthday, by the way. Anyway, so it's just been awful. So if you can help out, please help us out, and do it with a smile. There's some people who are really getting frustrated because it feels like to them that they're doing all the work, and we don't want people to feel like they're doing all the work. We want to smile and be helpful, and if you see something that needs to be done, don't just write it down and give it to somebody else to do. Let's just do it. These are tough times. We need to get through these tough times. I need your guys' help. Help each other. Smile. Be nice to each other. And I think that's it. If you guys have any questions for me, I'm here Monday through Friday, and sometimes on the weekends too. But we do not any longer have the clinical nurse on call phone. You're going to have to call me on my cell phone. My cell phone is posted throughout the building on a new flyer. Aaron Bloom is our acting administrator while Dawn is out on medical leave. So if you have concerns for the administrator or abuse reporting, you're going to have to call Aaron, and his phone number is listed on that poster too. Anyways, I'm going to get off here now. Thank you all very much for all your hard work, and take care.